Hi, I'm Alan Jeffrey. For over 15 years, I've been serving the patients, visitors, staff, and doctors at UC Irvine Medical Center, rated among the best hospital in the United States and home of many of America's top docs. I've gotten to know some really interesting people and have learned about the latest in surgical procedures and treatments in medicine. There are a lot of shows about the dirtiest jobs in the world. This is the first to look at the cleanest. Welcome to Cleanest Jobs with Alan Jeffrey. Hey there. Today we're going to take an inside look at the Department of Urology. We're going to be meeting with Dr. Rolf Klayman, one of the world's foremost experts. We're going to also spend some time with Dr. Thomas Allering, and he's going to give us a hands-on demonstration of robotic surgeries. So stay tuned. It's going to be a lot of fun. I'm headed over to the office of Dr. Rolf Klayman. He's a pioneer in the field of urology. His research led to minimally invasive techniques that have revolutionized kidney and urinary tract surgical procedures. Dr. Klayman currently serves as the Dean of the School of Medicine for UC Irvine. For the past 3 years, the Department of Urology has been ranked in the top 20 in the U.S. News & World Report Annual Best Hospitals. So tell me about these two, and then tell me about this thing I've heard, the Da Vinci. Okay. And we're gonna actually going to go from here to talking to Dr. Allering about the Da Vinci robot.
Right.
But tell us about what these do.
These are lasers, and so the laser on your left is called a green light laser, and this is used at our place by Lee Ronigan to take care of prostate surgery in the case where it's non-cancerous and it's causing blockage, so you can't empty your bladder. And so they've taken a procedure that was classically done with an endoscope, looking inside and cutting tissue away, at the end of which most patients were in the hospital for a couple of days. Catheter stayed in for 3 or 4 days, and there was potential for bleeding, to a procedure where the need for blood transfusion is almost non-existent. You can even do this procedure on somebody who's anticoagulated, meaning they have thin blood because they're taking medication.
So they didn't have the traditional risk of a surgery.
Exactly. And most patients can go home the same day or the next morning. So it's the laser energy applied to tissue is a huge benefit and has been progressing over the years. The laser on your right is a holmium laser, and this is specifically used for breaking up kidney stones.
And is this involved in some way?
Yes. Don't put that up your nose.
Okay. Maybe considering you are ready to go here, I'm going to stand back just a little bit while you describe this.
The thing is this, is that this is a laser fiber, okay?
You're smiling while you look at me with that. Look at that one.
What can I say? Fresh meat. No, this is a laser fiber, okay? And the thing is, these things can be as small as 200 microns, so it can be as small as a human hair. So we now have endoscopes, little tiny scopes that we can look through that are flexible, completely flexible. And you can take that endoscope and travel across the urethra, across the bladder, into the ureter, up the ureter, all the way into somebody's kidney. All right? And
let me stop you there. This is a scope?
No.
No, this is the...
I'm getting to this.
Okay, all right.
It's long-winded, but
Remember,
it's coming.
Remember,
she'll be coming around the bend. What?
You have to dumb it down for me.
Okay. So I have a scope up and I'm looking at a kidney, and now let's say I see a small stone.
Okay.
What do I do with it?
Right.
Well, you can't do much because you're going up this narrow tube. If you grab this big stone and try and pull it down, you're going to ruin that tube from the kidney to the bladder. So you'd like to destroy that stone.
Okay.
Well, you can take this laser fiber. So this scope is only 1/10 of an inch, 2.5 millimeters in diameter. It has a 1 millimeter channel, okay, really, really small. And you can take a laser fiber that is 1/4 of a millimeter, pass it through that channel, see it, put it on the stone, and it'll totally dust the stone out, just with light energy.
So,
it melts,
so you're saying
literally melts the stone away.
So the scope is in there.
Scope is in there.
And you say, hey, we got something, we're going to go get it.
Pass the laser fiber up.
And then you just
see it, and it's all on a TV screen. So you all watch this on TV.
And you're not having subsequent trips to do this. You go in.
No. It's one deal. You go in. It's an outpatient procedure.
Right.
Stone gets broken up. They may or may not leave a little piece of plastic behind as a stent to stop obstruction and go home the same day. But you know, it's amazing. I mean, you know, when I started out, if you had a stone in your ureter tube, you're going to have an operation. They were going to cut you open and take the stone out and sew things up. Today, the chance of requiring an open operation for a stone, almost unheard of. I've not done an open stone operation since 1985, regardless of the location of the stone or the size of the stone.
This really has not only enhanced people's lives, but in some cases, maybe even saved their life. Of something that could have been a surgery.
Potentially. I mean, you know, this is not, stones are not as life-threatening, let's say, as a cancer or something like that, but they certainly are life-impairing, you know, and it was Sir William Osler at the turn of the century who wrote that, you know, diseases that harm require treatments that harm less. And that's really the key thought here is how can we treat the disease and harm the patient less. That's the name of the game.
So on that point, does what these do, is that what the Da Vinci does?
Now the Da Vinci is a whole different thing.
So
these are instruments that have a specific purpose, if you will, for destroying tissue, destroying a stone. That's what a surgeon uses, if you will. The Da Vinci represents a whole paradigm shift. So that emanates from where we started out, which is with this, which is still used today. It's a Bard Parker knife. And this...
Will you trust me with that?
No, I wouldn't, but at any rate...
I signed my
stand back.
I signed my waiver. Okay.
Please step away from the knife.
So this is the traditional scalpel that is used for surgeries.
Exactly.
Okay.
So in 1869, in Heidelberg, Germany, a gentleman by the name of Gustav Simon used a knife and basically took out the first kidney. So we're talking almost close to 140, literally 140 years ago. What happened in surgery was the introduction of the concept of doing surgery through small holes, and instead of using your own eyes and head as the camera, if you will, in which case you need a big incision, use the technology that we have and put the camera inside the patient on a small rod, if you will, and then hook that up to a TV screen. So now instead of a big incision to look inside and see what's going on, you could now take a trocar like this, which actually goes right in through the skin. You take this out, and then through here you can put a telescope on a camera. So now you can see everything in the abdomen that you would normally see through that big incision. You say, well, how do you work? Well, then you take another trocar and put one over here and one over here and one over here, and now you got 4 trocars there. One for the camera, one on the left side, one on the right side for the surgeon's left hand and right hand, and maybe one over here for an assistant. And then through this, which is, so now your skin incision is just literally smaller than an inch. You can put all sorts of instruments. This happens to be a needle holder, and under the camera's guidance, you can open it, you can sew with it, and do anything you would normally do through
So
an
rather
open
than
incision.
traditionally where you would use a scalpel, make an incision, and you're going to work, now you have sort of 3 or 4 little drilling spots.
Exactly.
And you're working in a much smaller...
And the abdomen is filled with gas, so about 3 quarts of CO2. And you are, what I say, you're sort of hang gliding in the abdomen, looking down on the organs that you need to dissect, and then you're able to move them, and you can actually dissect them. And all of a sudden now, instead of an incision like this to take out your kidney tumor, you wind up with 4 holes this small.
Now we have the guy is here.
You have the guy.
And you're going to take us to him, right? Can we go? Will we go see him?
Do I get a finder's fee?
We'll see. we'll discuss that after.
I'll take, or at least a cup of coffee.
Okay.
Okay, but I'll take you to the guy. And the
Actually,
guy,
I've got a great pound of Sumatra that was just roasted.
Excellent.